My name is Aida Zvekic, and I am a clinical pharmacist with Humana. Heart disease is unfortunately too common. It's the #1 taker of lives in the United States. It's usually thought of as a men's disease because it takes 1 out of every 4 male lives in the United States. But what women don't realize is actually #1 killer of females as well. It's just that it takes 1 out of 5 female lives. Primary cause of heart disease is a coronary artery disease, and that's caused by plaques that form in those arteries. So the greatest risk is having high cholesterol. Not only that, high blood pressure, diabetes, obesity, physical inactivity, but there are also non-controllable factors. Of course, your age is your risk factor. Just like when we look in a mirror and we see our skin aging, our blood vessels are aging as well. We are all given set of inherited genetics predispositions that we don't choose. Some people, naturally, their body makes more cholesterol than they need. Bottom line, it will be the most prudent for those who are predisposed to consume heart-healthy diet, to be physically active, and to keep their cholesterol, blood pressure, blood sugar under control. If you are told by your doctor that your cholesterol is elevated and blood pressure is elevated, it will be advisable to do a minimum 150 minutes of physical activity per week. Heart-healthy diet means colorful diet. So fruits, vegetables, beans, nuts, replacing saturated fat with olive oil or avocado oil, and using protein that's lean in nature, like poultry or fish. Your annual screening does check for your cholesterol, your blood sugar, and blood pressure. That would alert you if anything is off so that you can act upon it and not develop heart disease down the road.